thing is that it has changed and it has not changed. It has not changed in that some of the issues that were with us 25 years ago and even earlier continue to remain with us. Maternal mortality, infant mortality, and within infant mortality, neonatal mortality. This is not to say that there have not been dramatic improvements. There have been. But even so, compared to many other countries, the situation is not very good. Some states have shown remarkable progress and others have not. So in that sense, the profile has not changed. But how has the profile changed? We are now very aware that non-communicable disease, cancer, diabetes, hypertension, mental illness, are hugely important and need to be addressed by the public health response system in the country. There's also a much greater awareness that factors outside the health system could also impact very crucially on health outcomes. So whether it is drinking water availability, sanitation, hygiene, which is relatively easy to understand. Also, school education, the safety and security of women, domestic violence, alcohol abuse. There's now a clear realization that all this also impacts on health outcomes. So, and that health policy responses need to understand this. So, as I said, things have changed, but many things have also remained the same. Well, the simple answer to that question is increased public investment into infrastructure, into medical education, and indeed into the education of health professionals of all types, into drug and pharmaceutical research, to support and strengthen the regulatory mechanisms. So we need to look separately at the three big pillars that constitute the health system: drugs and pharmaceuticals, devices, equipment, human resources, and physical infrastructure. Now, the big debate in India is on, does India need private investment in the health sector? Does it need private investment in addition to public investment? Does it need private investment as an alternative to public investment? But basically the answer is you need to put in more money into strengthening your systems. We are 1.2 billion strong, so we're always running to keep up with where we are. You know, big investment decisions are taken today. By the time, say, a project is completed, you find that your requirements have already begun to outstrip your resource position.